Now, in relation to content, the helpful things that we'll be looking at in this unit, sorry, 1 minute, let me just get this, relates to this topic. So if you're able to study at this level, doing justice to these very topics or subject matter that we have, you can easily apply it in every other field of study. So the first unit we have here, which is mandatory, is leadership and management in adult care. So under this unit, we'll be considering the theories of leadership and management. If you are writing, that'll be fine. We'll give you PowerPoints for each of the units. We'll give you unit breakdown, which breaks everything down for you as to what you need to do. There are 3 things we want you to achieve in this course. The first one is we want everyone to be able to acquire relevant knowledge that helps you to be able to work anywhere and everywhere as a health and social care manager in adult care, whereby you could be able to manage a care home, a care agency, or any other such related role in a managerial level, even when you have to work in the hospital, okay, or any healthcare related field of your choice. So we'll be talking about, so that's the first thing we want everyone to get, to acquire the relevant knowledge. Number 2, skills, skill acquisition. And when we come to talk about gathering evidence in relation to the observable criteria and other resources that we can use to achieve those observable criteria, we would look more into that. That's where much of the skill bit is going to come in. And the third thing we want you all to do is to be able to do your assignment and achieve your qualification at the end of this unit. So knowledge, skill, and the qualification. So these are the 3 things we will be focusing on. So having said that, back to the content. This first unit will be looking at theories of leadership and management. We'll be looking at the relationship that exists between leadership and management. You all know that there are two different things. A leader is different from a manager. So we'll be looking at that. We'll be looking at models of leadership and management. We will also look at strategies that we can use to handle conflicts in the place of work in relation to leadership and management, because as a leader and as a manager of a health and social care related work environment, there will be conflicts, sometimes conflict between staff, other staff members, or conflict between staff and service users or individuals or residents. So those skills are important. We'll be looking at leadership styles, different leadership styles, tailoring it to health and social care. We'll be looking at coaching and mentoring. They all come under this. We'll be looking at management and leadership skills. We'll be looking at internal and external drivers on leadership and management and how those impact on our work. We'll also be considering different situations and different teams in relation to leadership and management styles that we employ. We will also look at the importance of leadership styles for professionals in the health and social care environment, particularly adult care. Then an aspect of this will be continual learning and how that is important in relation to our experience in leadership and management. So basically, those are the content that will be covered under this first unit. Any question?
No, so far so good for me.
Okay. Are we all okay?
Yeah.
All right. Then we go to the second can we all see the second one? Governance of adult care. Thank you. Governance of adult care. That is also a relevant unit for managers in trying to understand issues that border around governance. Over there, we'll be talking about legislation and statutory guidance that applies to every aspect of service provision. You know that when we talk about health and social care, service provision, we have adult care, we have primary care, we have secondary care, we have adult care, you know, and different, you know, segments of it. We'll be talking about all of that over there. We'll also be looking at the influence or the impact of legislation and policy on person-centered care provision and the outcomes that the service users expect to get from the service delivery. We'll be looking at your own role as a leader and a manager in health and social care. We'll be looking at your areas of accountability and your responsibilities in implementing the various legislations and the statutory guidance. So that's basically we're talking about the law and the regulation that governs our role as health and social care managers and leaders. We'll also look at the purpose and function of different models of service delivery, how service is delivered to adults who need the service. We'll also look at management and governance across the different models of service delivery. We'll explore innovation in relation to models of service delivery. For example, when you take the pandemic that hits the whole world, innovation has to be applied in delivering the services to be able to handle the pandemic. So we'll be looking at that as well. We're looking at internal governance procedures that are used in different organizations. And you will also have the opportunity to explain your own role in applying and leading and evaluating the service delivery in relation to the governance procedures and agreed ways of working. So that is what the second unit is about. It's not a lot, it's not massive. When we begin to teach, you realize that there are, you know, just major chunk of things that we need to put together. Okay, any question there before?
Yes, Mr. Chris.
Yes, Nina?
Yeah, these are the PPT that you are just sharing right now. So this PowerPoint is only for one unit, first unit, right?
No, I'm not sharing PowerPoint for the unit. What I'm sharing,
then what is it?
What I'm sharing with you is the unit.
Okay, so
for example,
the slides that you are showing us,
yes,
this is for separate units or for what you have already started with the first unit?
Okay, so this is first unit.
Okay.
This is the unit title.
Right. Okay.
Okay. This is just illustrating the unit title.
Okay. And the second one, governance
and
of
the second one is the second unit, governance of adult care.
Okay. So you're just giving a helicopter view of all the units.
That's right.
Okay. Okay.
Because you talk about content, isn't it? That's one of the things you want to get from this. Okay. I'm talking it through, but all of those things are things we are going to teach, we are going to learn, we are going to do together when we start the delivery.
So we haven't started with the first unit content, like no, we haven't started studying basically. We are just doing the induction.
Yeah.
Okay.
Is that clear?
Yeah, sure.
Okay, so basically I'm giving an overview of each of the units and what they relate to. Lalita, any question from you?
No.
Sarah?
No, everything is fine.
Okay. So Right. So Nina,
Yes.
what can you see? What's the next unit?
Communication and information management in adult care.
Nina, are you with me?
Yes, yes.
Can you hear
Hello?
me, Nina?
Yeah, yeah.
I can't hear you.
You can't hear me? Mine is... What happened, Bhai?
Can
I
anyone
think
hear
it's the
me?
problem with the Chris network.
Huh?
Actually, I can hear all of you.
Yeah,
I can hear all of you.
Yeah, you can hear us, Chris?
I think he had a problem.
yeah,
You can hear me. Oh, okay.
Yeah.
So Nina,
Yes.
okay, thank you. So that's the next unit. Okay. So under that unit will be, yeah, I can hear you.
Yeah.
Can you hear me? I can hear you. I can hear.
I think there's problem.
I think the host has some problem
Yeah,
for Chris only.
He left.
Yeah, he left.
I think there's some connection problem.
So only 3 of us doing the course.
yes, I guess.
Yeah.
4:30 to 6:30. So Wednesday and Friday. Yeah, Krish is there here.
Yeah, I think I lost everyone.
Oh, we are here.
Raj.
Yes,
Right back. Yeah, could you please give me access to share?
you're already host. You can.
Okay. All right. So communication and information management in adult care. So in adult care, we manage a lot of information of staff, both staff and patients or residents, individuals. So under this unit, we'll be looking at how to use communication skills, basically, in relation to the individuals, their families, and also the staff that look after them. Will also be able to. Much of this unit is covered under observable outcomes, or we would need some documents to evidence your understanding and achievement of those. And so the written work here will not be very much. And that's another advantage for some of the units. You don't have to do a lot of writing, which is also very helpful with evidence, with other modes of assessment. So we'll be over here, we're going to demonstrate our understanding and ability to communicate using different communication styles and methods and skills with the service users or the individuals and their families or relatives. Then we will also explore effective information management, how to manage information effectively, ways to manage information effectively, how to respond to a breach of data, and also reporting procedures. They will be talking about things like confidentiality and GDPR, and what are the limits to confidentiality. If an individual or a patient or a service user tells you, I want to share something with you, I don't want you to tell anybody. How do you manage that? Are you going to promise the service user, okay, you keep it a secret? What are the limits to that? And what are the consequences of all of that? We'll be talking about much of that. Then an aspect of it is cybersecurity. And the last thing we'll talk about in this unit will be implementing systems for effective information management. So that's what we'll be looking at, policies and implementation of policies and systems for effective information management to meet legal and ethical requirements. Okay, so that's what these units relates to. Any question there?
No, I'm good.
Okay, Lita.
No questions. I'm also good.
Okay,
Yeah, fine.
Lalita.
Yeah.
Okay, Lalita, what's the next unit you can see?
Yeah, it's outcomes-based and person-centered practice in adult care.
Outcome-based and person-centered practice in adult care.
Yeah.
Right. So under this unit, there are 6 learning outcomes. Some of them are, we have some of them that are observable, and the others we need to write about them. So the first learning outcome, we're going to be exploring the principles and values of outcome-based and person-centered practice. So this unit basically is saying, if you are providing service to a group of adults, maybe they have dementia, what do they need to receive from the services you are providing for them? Or a group of adults that have physical disability, and you are managing that service provision or unit. What do they expect to receive or get from the services that have been provided for them? That's what we relate to as outcome-based and person-centered. Person-centered is the services have to focus on the needs, the wishes, the preferences of the individual. So we're looking at strength-based approaches that we use to deliver services, person-centered approaches, active participation. How do we involve the service users or the individuals in the care that is being provided for them? Then we'll look at outcome-based practices as well. Then we'll also, this is where we have to observe you. There are times we will have to input role play, because I understand that most of you are not already in the health and social care work setting or environment. So we would need to input some role plays that will be observed to ensure that such outcomes are achieved. So over here, we're looking at how to lead practice to facilitate positive outcomes, and how to promote well-being and independence for individual service users. All of that learning outcome is observable. And the next one that we'll explore will be the importance of promoting the health and well-being of individuals. Some of them are very general things you already practice in your home, on your own, and some of you with your children and family as well. So would apply that here. Then we'll also look at the role of relationships in promoting health and well-being. So is it better when people have other people in their lives? Does that promote their health and well-being? And when people are living alone, how does that affect their health and well-being? So relationships in promoting health and well-being. We'll be looking at the practice of promoting individual health and well-being to achieve health outcomes. So I think you are aware of 5 a day. What is 5 a day? You can tell us what 5 a day is. Nina, you've had 5 a day, isn't it? What does it mean?
5 a day.
Yes. Who knows about 5 a day? Who knows about 5 a day? Okay, there is a saying that a fruit a day, an apple a day keeps the doctor away.
Yeah.
Anyone heard that?
Yes.
Okay. All right. So things like that, these are health outcomes, those are some of the things we'll be talking about. Then the last thing that we'll be covering under this unit will be recognizing individuals' relationships and how that supports their health and well-being. So we're looking at approaches which recognize individuals' sexuality and relationship needs, how to promote open, proactive culture, where individuals and others feel confident to discuss their sexuality, among other things. So basically, that is what this unit is about, outcome-based. Any questions so far? Stop me anytime if you feel you have a question. Is that okay? This is one of the simplest and easiest units. Equality, diversity, inclusion, and human rights in adult care. Very, very simple units. We'll be defining the various terminologies in relation to equality, diversity, inclusion, and human rights. We'll be looking at their importance in relation to ensuring the dignity of each individual service user, no matter what they are suffering from, no matter what is going on with them. We'll be looking at the laws that support equality, diversity, inclusion, and human rights, and how to implement them. Taking note of the individual's personal faith, religion, beliefs, and all of those things that come in between. So that's what this unit is about. Then continuous improvement in adult care. Basically, it's talking about how, as a healthcare worker, you need to update your knowledge in relation to changing government regulations and policies and procedures. For example, when you take this pandemic, for those who work in the healthcare sector, you realize that different policies and procedures keep coming. And so it's important to keep updating one's knowledge to know what is outdated and what is updated, what is outdated, out of use, and what is updated, what is the current practice, and be able to ensure that your staff and yourself keep to them in order not to be in problem with the law, but to be on the good side of the law. So we're talking about relevant practice in relation to guidance and requirements, quality improvement activities. We'll be looking at compliance activities that can support person-centered care and outcome-based practices. We'll be looking at how to evaluate progress towards achieving positive outcomes in relation to person-centered practice for all patients and service users that are looked after, and how to improve all of that. We'll be looking at reviews and implementing of improvements to systems and processes and practice in the healthcare environment in relation to adult care. So that's what that also relates to. Then we have professional development in adult care. Do we have any question? Do you want to add anything, or should we continue?
No. Yeah, we can continue, I guess.
All right. Yeah. Sarah?
Yeah, fine, no problem. Continue.
Okay, yes. So what's the next unit, Sarah?
Actually, can you share this in WhatsApp or this document to mail or something like that, so we can all.
Yeah, at the end of the,
Yeah.
the session, yeah, I'll share it with you.
Okay.
Is that okay? Okay.
Yeah.
So what's the next unit there? You can see
Professional
professional
development.
development.
Yeah.
Yes. So in this unit, we'll be talking about the principles of learning and professional development in adult care. So we'll be looking at potential barriers and constraints in relation to professional development, the importance of professional development, workforce planning and development. That is where you plan for your staff to receive not only reviews, but also trainings in relation to where they have gaps in their performance. We'll be looking at mechanisms and resources that support learning and professional development in adult care. Then we'll also explore professional development practices that promote professional development and the learning culture within a particular team that you manage as a health and social care manager. We will also explore the development needs of adult care workforce in relation to digital skills. So we're talking a bit about digital skills and digital knowledge and skills of yourself and your team that you manage. So that's what this unit basically relates to, because the world is changing, a lot of things are changing in the world, and so we need to learn how to change with it. Lalita,
Yes.
would you like to remind us of the next unit?
Yeah.
Please.
Supervision and performance management in adult care.
Okay, thank you. So one of the things leaders and managers do is they supervise to ensure that your staff are doing the right thing. They are performing at the right level, meeting the standards. So in this unit, we'll be looking at the purpose of professional supervision in adult care settings. So then we'll be talking about some theories and some models of professional supervision. Then we'll also discuss the process and the practice. How do we do supervision? The process and practice of supervision and performance management. Okay, so we'll look at some internal and external factors that influence this. Then we'll also explore the procedures to address performance management and related issues. So if some staff you realize are not performing at their best, how do you manage that? How do you find out what is happening to them and how to be able to help them to increase or improve upon their performance? Then we'll also explore the signs that may arise and the signs that may raise concerns and how to support the health and well-being of your team members within the scope of your own role so that they can perform at their best. And the last thing that will be covered under this unit will be looking at the boundary, regular, establishing agreement with your supervisee in relation to you, the supervisor, and how to establish professional supervision within the team as a regular practice. Right. Another very easy unit that we'll be looking at is what, Nina?
Yeah, well, it's
Sorry
adult.
to interrupt. Hello.
Yeah.
Yes, sorry.
Can I leave because I have shift on 2:30? Because I need
Okay, you have a shift at 2:30.
Yeah.
Oh, okay.
Part-time, doing part-time, that's why.
Okay, yeah, that's fine. Do you have
actually,
any?
I have 2 days in a week. 2 days I have class, Wednesday and Friday. So when you getting the timing and all, you just consider this. Okay, I have 2 days.
Can you
class.
tell us what days will be suitable for you?
For me, except Wednesday and Friday, I'm okay. Even in the Wednesday or Friday, if it is morning session, also no problem because I have class on 1 p.m. 1 p.m. to 5 p.m. I have class. So even in the night or in the morning, it's okay. But afternoon, that 1 to 5, I can't.
Okay, so
attend the class.
Wednesday can work for you. I'm going to talk to Nina and Lalita. Wednesday can work for you if it is morning or if it is after 5. Is that what you mean?
Yeah.
Okay, so if it's
Wednesday and Friday, in both
time?
days I have class like 1 to 5 p.m. So
okay, so apart from Wednesday and Friday, which other days will work for you best? Monday?
Yeah, Monday I have to go to office like.
So Monday is out for you.
Yeah.
How about Thursday?
That's okay. I can adjust, no problem. It's online class, so no.
Sorry?
No, it's okay. It's fine. Monday is also fine, no problem.
Monday
So
is
you are
fine for
fine
you.
with the evening batch, Sarat?
Yeah, evening time I am also fine. No problem.
Okay, so we can discuss it later if you're leaving right now. So mostly we'll be keeping in weekdays only because I think Lalita is also comfortable in weekdays, not weekends. So whatever time we'll be deciding,
Yeah,
we
fine.
can let you know.
Okay, before,
Yeah, okay.
thank you, Naina. But Sarah, before you go, can you give us an idea what time will work for you in the evening? From what time?
I think we can start from 6 o'clock because 1 hour travel is there from college to my home where I'm staying. So that 1 hour also is a just even train the Wi-Fi and all is a big problem. That's why. So we
Okay,
can
so that's
by 6
for Mondays
yeah.
and Fridays.
Yeah.
That's for Mondays and Fridays, right?
No, Wednesday and Friday.
Naina, could you take note of some of these things for me? I'm taking note as well, but just in case for a backup. So
Yeah.
are you saying this, sorry, Sarah, did you say this will
Okay.
apply more on Wednesdays, Mondays and Fridays or any other day for you?
I think Wednesday and Friday morning or the evening after 6 I am okay, and the rest all other days are also okay. But in the section which 1 to 5 I can't attend the class in Wednesday and
Okay.
Friday. So this.
Okay, 1 to 5 on Wednesday and Friday is not suitable for you.
Yeah.
Thank you. Thank you very much.
Okay.
Yeah,
Thank you.
Daddy.
Okay, thank you for being here.
Okay.
Yeah.
Yeah.
All right.
Bye.
All the best. Okay. Bye. Good. Thank you. Nana, I hope you took note of that for us.
Yes, whatever days he can't take, I've just made the note of it. And
Okay.
rest we can see.
Okay, that's also very important for all of us in relation to you and Lalita because of childcare. So can we finalize that now before we go on? Is that okay? Because that also
No problem.
helps us determine how soon we can begin.
And one thing I'd like to ask you, like whenever there'll be a session, it will be a 2-hour session?
Yes.
Okay.
Yeah, a session will be
So
for 2 hours.
Lalita, is it fine with you Tuesday and Thursday evening 6 to 8?
Evening, I'm okay. Yeah.
Is it okay with you, Chris?
Yeah. For me, it's okay.
Thursday evening.
Yeah, Tuesday and Thursday 6 to 8.
1 minute.
Yeah.
1 minute.
Just check your schedule.
Plus, Nana, that from 1st July till 11th July, I'm not able to attend.
Sorry, Lalita, what did you say?
Yeah, from 1st to 11th July, I'm in India, so I am not able to attend the classes. From 1st to 11th.
1st July.
Yeah, so
to
either
11
we
July.
can drop the classes during those days, or we can, because anyways you are doing the recording.
Yeah.
So we can send her the recording.
Yeah, for that I'm okay. Yeah.
Okay.
Yeah.
You'll be okay. You'll be okay with the recording.
Yeah.
If you miss those sessions. Is that what you're saying?
That's fine. That's fine.
Okay.
No issues.
All right. So thank you, Lalita.
Yeah.
Naina, back to you. What days were you suggesting, please?
See if everybody is comfortable in evening only, so we can see maybe Tuesday and Thursday 6 to 8. If you are comfortable with it.
Thursday. I'm comfortable with Thursdays, but if it's going to be Tuesday, 6 will be too early for me.
So maybe Monday and Thursday.
I'm fine with Mondays.
Okay.
I'm absolutely fine with Mondays. So Mondays and Thursdays will work best for me for now.
No worries.
Yeah. If anyone has emergency or some urgency and we need to adjust, we can adjust. We can always adjust because we are flexible. At the end of the day, we want to meet your needs. You understand? Yeah.
Okay. And how many sessions throughout the qualification you will be taking? Like, because we are doing 2 sessions in a week, that means it will be around 8 sessions in a month. because
Okay,
considering
so
4 weeks in a month.
okay, so 2 days were proposed on the sorry, let me just share this. Sorry, 1 minute, please. Okay, I think 2 days were proposed, isn't it? On the delivery schedule that was shared. But I think I heard Nina say that Friday is not convenient.
Friday for me it's fine, but
No,
for
not Friday.
Cyrus,
Sorry.
Wednesday, yeah.
That's
Wednesday, my
mistake.
son goes to
Not
cricket
Friday.
club. Yeah.
No Friday. Sorry, I meant Saturday. Sorry, I'm so sorry. I meant Saturday.
You're in Saturday, but Saturday Lalita doesn't want to do now in weekends.
Okay, Lalita, you're not free. You're not available on the weekends.
Only Saturday. Sunday I'm okay, but Saturday, yeah.
And then even
You're not
if we
available
want to do
Saturday.
or Saturday or Sunday, so we can only do before 12 in the morning, because for the class we can't do the whole you can say what you call the whole day, the whole weekend we cannot stuck. So
No, we can't do
thought,
Saturday and Sunday. No, it will only be one weekend.
you want to
It
do
will only
on
be
weekend?
one day of the weekend.
So
No, you are
Because
saying Sunday, isn't it? So we are thinking about Saturday and Sunday now, isn't it? And I'm saying that we can't do Saturday and Sunday together, no, because
No.
that will be all your weekend gone.
But in
isn't
your
it?
schedule, if you just can you go down a little bit? Yeah. See, in your schedule, whatever days, just don't worry about the days right now. If you see the timings, it says 2 hours on one day and 1 hour on another day. So that means we'll be doing only 3 hours.
So that was a proposal because which we wanted to discuss with you. Are you with me?
Huh?
Because everything that we are agreeing has to be
Yeah.
agreed in discussion with you all.
Yes, yes, I agree.
Yeah. That's
So,
so
like
these
if we
are
are doing it 3
proposals.
hours, or like every session will be 2 hours each.
So the 2-hour session will be the delivery of the content.
Okay.
The 1-hour session will be looking at the assignment and the
Okay.
assessment and
All
how
right.
to approach it.
Yeah, works fine with us. Works fine,
that okay?
completely fine. So that
Okay.
means it will be 2 days that we are engaging, but
2 days.
it will be
yeah,
3 hours.
That's right. Would that
Good
be
enough.
okay?
So suppose if we are
Okay.
doing Monday and Thursday, so Monday it could be like suppose 6 to 8, and Thursday it will be 6 to 7, like that.
That is fine, like that. If that time is suitable for everybody. I know that sometimes there may be some days that something may change for somebody. We are happy to adjust and
No, but like this will be the formal schedule for all
the
of
format.
us.
Yeah, that's
If in
right.
case,
It
for
will be.
example, like Lalita is going to 10 days to India, I'm planning to go for 5-6 days in August. So that we can manage. That we can discuss during that time.
Yeah.
Yeah.
That's right. Yeah.
Okay. So Lalita, are you comfortable with Mondays and Thursdays evening?
Yeah. Perfectly fine.
Okay. So Chris, can we do Monday 6 to 8 and Thursday 7 to 8?
Monday 6 to 8. Okay. By which time Sarath will be available as well, isn't it? Because
Cyrus said that he's fine with any day apart from Wednesday and Friday. So we are not touching Wednesday and Friday.
Okay. And Thursday, so Monday 6 to 8, and Thursday, what time did you give, Nina?
If you're fine with 7 to 8, otherwise 6 to 7 is also fine.
7 to 8. 7 to 8 to be fine. Is that fine with you, Lalita?
Yeah.
Okay. 7 to 8. All right. Okay. So I'll take these proposals to the team. Is that okay?
Yes.
And Mansi will communicate with you in affirmation, and then we take it from there. Is that okay?
Yeah.
Fine.
Good. Well done. I like the way you ladies have handled this. That's very impressive. Okay. Is there any other question?
No. I'm okay.
Okay. Right. So we have Monday. how soon are you ready to start? If I may ask.
I'm okay. Today is Saturday. Yeah,
Today is Saturday.
yeah, I'm okay with coming Monday only because anyway, in July, first 10 days, I'm not here. So,
Okay,
yeah.
so the earlier we start, the better.
Yeah. For me, it's okay. Yeah. I am okay.
Nina?
Nina is not here, I guess.
Oh, okay.
Yeah, now she's here.
Okay.
Yeah, sorry.
Lalita, could you please repeat what you said earlier on so that I know?
How soon you think we should start classes? I am okay coming Monday also to start the sessions or classes.
Nina?
So after this induction, we'll be starting the class. Today is what? Saturday. So we can start from Monday, this coming Monday, isn't it?
Yeah.
Yeah. Are you okay with that?
Yeah, no worries.
Okay. So Monday we are looking at 6 to 8, yeah? And then Thursday, 7 to 8. I'm going to forward this to the team, and Mansi will confirm that to all of you. Is that okay?
Yeah.
Okay.
Thank you very much.
And before Monday, if we are starting this Monday, that is day after tomorrow,
yeah.
So I'll request you to please send the content, like the whole unit module for this unit 1 that we'll be starting.
Okay. Yeah, you will receive it before.
Yeah, and one more important thing, like in cash, when we did cash level 3, it was the books that we were provided, because you know what happened is it's not possible for the teachers to give the whole lot of in-depth detail in that 2 hours, right? And when we were asked to do the assignments, anyways we had to go through a lot of content and reading material and browsing and surfing through the net. So the book was provided to us, even though it was there on their online platform. It was the whole book available online, and some students also bought it because, like, you know, you can actually, the tangible book is of course better than the online soft copy. So even I bought it. So while reading the chapters, it was quite easy to do the assignments. And if in case in this current qualification that we are doing, if it's more based on observation, and so still we need the data and the content to read. It will be like the Bible for us throughout the qualification. So if you can suggest any book for level 3 adult care, I think because it is available, it could be, we can get it from Amazon or Waterstone or anywhere. Yeah. Or even we can get the soft copy also, because I have Kindle and iPad also. Oh, okay. That's great. Yes. So thank you. That's a very important because without book, just by seeing the slides, it will be very difficult to do the assignments. I've gone through. Without the book, assignments cannot be done. Yeah. And then I have the idea for the child care, which is like only till age of 5 or 7 maximum. But this is adult care, and they have the separate, like, different set of rules and regulations altogether. Yeah. So my cash level 3 book will also not help me in this, definitely. Yeah. Your cash level 2. Level 3 will help you. Level 3 will help you where you in relation to safeguarding and equality. Yeah, that could be there. Safeguarding and legislation and framework also is also the same. Just that it's at a lower level, and over here you have to, you know, beef it up. You understand? Yeah. Okay, I've taken note of your a very good contribution in relation to the books and resources. Yeah, so you can suggest at least one good book, and we can either buy the Kindle copy of it or the hard copy, whatever suits us, because hard copies in UK are quite expensive. And I don't mind to buy the Kindle copy as well, but definitely I need one. All right. Because then so internet has this problem now, then there'll be a plagiarism issues raised if we take directly from the internet. That's also important, yeah. And we're going to be talking about referencing. And one more thing, like you haven't clearly told us that how many assignments will be there, because most of the units you said will be based on observation. But suppose if we won't be able to go for observation or do it live, if in some cases, so we can do the role play. So as far as role play comes, role play also means assignment, because we just need to assume and then write it down, isn't it?
Okay. All right. That's a good question there. So for each of the units, there will be an assignment. You know, of course, that we are not writing in the exam. It is assignment.
Yeah, assignment based, yeah.
So every unit has an assignment.
Oh God.
And some of the assignments are written coursework. Okay. And some of them will be observation, like I was talking about. Because you are all not already in a health and social care role. That is why in some cases we will need to do a role play. Okay.
So that also we need to write it down, right? Like an observation, isn't it?
Yeah. So when you role play, when you do the role play, we will do the observation and write down, write our observation report of your role play to cover the criteria that needs to be met. And some of them, there are work products we need to present to meet the criteria. All of that we are going to give to you. We'll tell you what you need to provide here and here and here to meet this criteria. So that's not a problem. Don't worry about that. That is why we are here. We will help make it easy for you. Okay, you are not alone at all. Okay. It's not on your head alone. We are all carrying it together.
Yeah, please.
Okay, to help make it easier.
I'm new to this side, healthcare.
Yeah, I understand. Yeah.
Like so if you know this book by Penny Tassoni, Level 3 Early Years Educator Work-Based Learner, the textbook endorsed by Cash. So this book was like very nice. It was like the Bible for me. It really helped me to crack through the qualification because it had all the chapters and all the learning outcomes. So what happened is whenever we had to do the assignment, you can even tally that, like this is suppose LO3 is there, LO3, 3.1, 3.2, 3.3. And that exactly LO is there in that same unit, in that same chapter. So we can just read it and then write it in our own words. Okay. So I'm quite sure that for adult care also there must be some book.
Yes, so we'll give you the reading list. We'll give you the online sources that are helpful where you can get relevant information. So for every unit, like the first unit we are going to start with, you will get what is called, you will get the assignment brief for it. You will get the unit breakdown. That is a helpful guide to how to answer the questions. And then you will get a reading book, a reading list for each unit. Is that okay?
Okay.
Yes.
And how much time will be given to submit each assignment?
So that will be on the assignment brief that we sent to you. The duration will be on the assignment brief. So on the assignment brief, you have the start date and you have the submission date. Okay. You will get all of these. It will
be like the ongoing process. For example, we completed unit 1. So within that week, we have to submit the unit 1. It will be like
when we finish unit 1, when the deadline is due, then you submit it. But I will give you time to do the assignment. No pressure at all.
Yeah, please. Time. We have 2 kids.
Yes, I know, because you have children, so there are family.
Yeah, but I would suggest, like, as for my personal experience, if we are given a kind of serious deadline, for example, 7 to 8 days for one assignment each, so that it doesn't get piled up.
No, we will not pile up work on you.
Yeah.
We know you are family people, so.
Because we have lost the habit of, learning everything all together and giving the exams like kids. So if we are doing it in a continuous way, so at least the units will be clear in our mind and then it won't pile up at the later stages.
It won't pile up. Yeah. Okay.
We'll and is there any case study also at the end of this whole qualification? Any major practical thing that you'd like to see, or any practical case study kind of thing, or just unit based?
So no, the case studies, where the case studies will come, that is where, the areas that the learning outcomes that and the assessment criteria that need to be observed. And some of those have to be observed in the work environment. For example, where you are working in a care home or something like that. Where we can't get that done, some of the scenarios will be given as a case study or work products. And each of them, it will be indicated in the assignment brief what you should provide to meet that criteria. We'll do that with you. Okay? So no problem at all. No tension at all. But I'm happy about the questions you are answering. Very good questions that show your commitment to the course. And that's impressive. Yes.
Thank you, Chris. So basically, we have to be given two things. That is a unit brief for the unit 1 that will be done on Monday. That will be doing on Monday.
On Monday.
And some book suggestions that you need to give us.
Yeah, reading list. You get a reading list. You get assignment brief. There will be a PowerPoint presentation for the unit. And then you also have a unit breakdown. 1, 2, 3, 4. So 4 different things you have for each unit that will help you.
So along with the assignment brief, you'll be also sending the assignment sheet, like the questionnaire that we need to do.
Yes, so you can use the assignment brief as the template, or we could also design an assignment template. Yeah, it's better so we have templates that will help you, just write up your assignment in the template. So sometimes it is helpful when students just develop their work on the assignment brief. So as you write, it goes down, and everything is all together. But in any case, you have the templates to use, so don't worry about that. Assignment template. Is that okay?
Okay.